In healthcare, there are countless ways to make a difference. Some are big, some are small, all are meaningful. Here are just a few examples of how CVPH people made a difference in the lives of others in 2018.
The difference is
responding to more than 3,500 emergency 911 calls for help in the community.
Expanding our pediatric hospitalist program
to better care for our youngest patients.
Creating an activity room for patients to use during their stay.
Welcoming 60 new healthcare providers.
starting on an epic journey.
To create a unified electronic health record across the network to enhance patient care.
Welcoming our skilled nursing residents into their new home.
Developing a system to help measure and minimize using treatments with opioids in the emergency department.
Upgrading parking lot lights to save energy and improve safety.
The difference is
raising more than $30,000 for the Janice McLean Fund for CVPH people in need.
Collecting more than 800 pounds of unwanted medication.
Removing them from the community and keeping them out of the water supply.
Putting patients first and being recognized as an NCQA patient-centered medical home in both our adult medicine and family medicine practices.
Partnering with 44 dedicated primary care providers to expand access to hepatitis C treatment across 5 counties.
Connecting people by welcoming the community to the front lawn.
For our summer concert series.
By launching the employee intranet.
And telling our story through CVPH people.
And through the eyes of our patients.
The difference is
establishing a regional transport system to move patients between network hospitals more efficiently.
Awarding $191,000 in mini grants to help departments enhance patient care.
And helping patients transition homes safely by providing over $10,000 to purchase items like blood pressure cuffs and talking scales.
And so much more to help patients monitor their health at home.
A new coaster pager system for us to better communicate with patients and their families.
Educating more than 1,200 folks in the community about prostate and breast health.
Providing appointments within days to newly diagnosed cancer patients.
New technology that's shortening cancer radiation treatments and upgraded imaging that results in greater precision and alignment.
Launching Yoga for Cancer to help cancer patients and survivors manage side effects of treatment.
Raising awareness to create a diverse and inclusive experience for our patients and our people.
Woo!
Supporting the health, safety, and well-being of our employees.
The difference is
receiving verification as a Level 3 trauma center.
Growing our team of employed physicians.
Launching our ED residency program.
Implementing an antibiotic stewardship program for patients presenting with bronchitis.
And going Dilaudid free to help fight opioid addiction.
Preventing infections by sterilizing almost 250,000 items for our patients.
Volunteering more than 20,000 hours to help improve the patient experience.
Expanding access to the library resources, whether you visit us online or in person.
Taking HR on the road and rounding on departments on a quarterly basis to connect with our people.
And to say thank you.
Converting 2,500 active employee files to paperless to improve efficiency and cut down on waste.
Continuing with our cultural learning to take even better care of our patients and each other.
The difference is
ranking among the top in the country for patient satisfaction.
And upgrading our cath labs to continue to offer the highest quality care.
Opening our new diagnostic center at Hudson Headwaters in Champlain to treat patients closer to home.
Honoring extraordinary nurses with the Daisy Award.
For making a difference in the lives of our patients and their families.
Expanding our family medicine program to welcome 6 new resident physicians each year.
The difference is
by embracing lifelong learning. CVPH provided over $750,000 to employees in education funds.
Using technology to educate and enhance clinical skills.
Reducing PICC-related thrombosis by 33%.
Reducing the number of bloodstream infections in patients with a central line. And obtaining IV therapy certification for all eligible employees.
The difference is
reducing the number of days using a central line catheter by 1/3.
Offering hepatitis screening to baby boomers, which grew the number of patients tested 6-fold.
Having our radiology students perform nearly 8,000 radiology exams to gain valuable hands-on experience.
helping our people through difficult and stressful times by reaching out and following up.
Standardizing patient rooms to decrease staff injuries by 35%.
Introducing a new product to decrease the use of catheters and incontinence-associated dermatitis in our female patients,
while increasing comfort, convenience, and reducing cost.
Welcoming 400 new patients and healing more than 528 wounds.
The difference is
partnering with Alice Hyde Medical Center on a regional approach to remote telemetry.
Increasing health home enrollment and outreach 800%.
To help patients and community to achieve optimal health and well-being.
Welcoming 51 graduate nurses to the organization.
We implemented a new fall protocol and greatly reduced the number of patient falls.
And we're not done. By thanking our people for the great work they do.
Every day.
The difference is CVPH.
The difference is you.